Okay. All right. The camera's on. Is that okay?
Yes.
Okay. And you have your top off?
Yes, I do.
Okay. And no socks on? Okay, good. So we
Okay.
can check everything. Perfect. Just going to get my light. Okay. Put that right in there. We checked your vital signs. Your blood pressure is 120/80. Your pulse is 79. Your temperature was 97.9. Your respirations are 16. Your pulse oximetry was 99% on room air. So those are all normal findings. You're 5'10", and you weigh 202 pounds. Was that correct?
Yes.
Okay. All right, great. So the first thing we want to check, we're just going to look at your scalp and your head. Just check and make sure that the distribution of your hair is normal. There's no cuts or any wounds. It's normal cephalic and atraumatic. Also, I'm just going to look at your skin. And I'm going to continue to keep looking at your skin as we go through the whole exam. Do you know if you have any open cuts or sores anywhere?
No, ma'am.
Any parts of your skin that's bothering you, dry skin or problems like that? I'm just going to look at the skin on your hands and legs and your feet. And I check your nails. Your nails look healthy. And I check your capillary refill. That looks good. There's no blanching. See your toenails. Can I just have you fan out your toes? Okay, that all looks very good. I'm gonna have you check your sinuses. Just let me know if you feel any tenderness at all. Anything?
No.
Any problems?
No.
Okay, open and close your mouth. Okay. All right, there's no dark circles under your eyes. There's no edema, no tenderness with your sinuses, so that's good. Gonna just check your temporal pulse. Okay. Looks very good. And feel for your lymph nodes. Let me know if you feel any tenderness. Any problems at all?
No.
Okay. Open and close your mouth. For any TMJ. That looks good. All right. I'm gonna check your eyes, okay?
Okay.
So one of the first things I'm gonna do is just check and make sure that they are the pupils are round and equal, reactive to light and accommodation. Okay. All right. And now just follow the movement. Oh, look straight.
Okay.
Then follow the movement. Okay, very good. Oh, 1, 2, just follow that. Okay, all right, great. Now look straight. And I'm going to have you just tell me when you can see the light, and just keep your eyes straight though.
I can see it.
And again.
I can see it.
Okay, awesome. I'm going to have you use what's called a Snellen chart here. Just if you can check what's the line that you can see, that you feel that you could read clearly?
Line 9.
Okay, you want to go ahead and read that?
LEFODPCT.
Okay, now do you want to cover one of your eyes and now read it backwards?
TCPDOFEL.
Okay, and now switch and now cover the other eye.
Okay.
And then go ahead and do that again.
LEFODPCT.
Okay, and now open, and now why don't you go ahead and try and read the line right underneath that one with regular.
FDPLTCEO.
Okay, great. So it looks like It looks like you have 20/15 vision in both of your eyes, so that's excellent. I'm just gonna look again. Okay. Looks like your sclera is clear. There's no jaundice. Your iris is brown and round. Your conjunctiva is pink. It looks healthy. And your vision is good. Any other issues going on with your eyes?
No, ma'am.
Okay. Excellent. There's no nystagmus, no jerking. So now we're going to go on and check your ears. Okay. Let me know if you feel any pain or tenderness at all, okay? I'm going to inspect the outside of your ear. It looks like it is the same color skin as the inside. And the rest of your skin. I'm going to look for your tympanic membrane. Okay. Any tenderness at all?
No.
Okay, I see your tympanic membrane. It's gray and pearly. Does that bother you at all, that being in your ear? Okay.
No.
Okay. Same with this ear. Any problems or pain?
No.
Okay. All right. I also can visualize your tympanic membrane. It looks gray and pearly. I'm going to just whisper in your ear. Just repeat in a normal voice what you hear me say, okay?
Okay. 99.
Good.
Goodbye.
Great. Thank you. So some of these tests are a little silly, but we're just trying to check everything, make sure everything's good.
Okay.
I'm going to look in your nose. All right. Slipped up. Okay. Looks healthy, no blockages. I don't see any polyps. Just do this and then breathe in. And now go ahead and do that with the other side. Okay, great. All right, now close your eyes for just a second. Okay, I'm gonna put a cotton ball to different areas. Just touch where you feel it, okay?
Okay.
Okay, very good. And now keep your eyes closed. And then just let me know if you can smell anything and if you can tell what it is.
Okay. Oh, alcohol.
Yes, very good. Thank you. Okay, now we are going to just check your mouth. So open your mouth. Say, ah. Okay, I see your uvula is centered in midline. Okay, now stick out your tongue. Okay, go ahead and put that back in. And then go like, just so I can see your gums. Okay, your gums look healthy. Do you see the dentist regularly?
Yes, I do.
Okay, now the top. Okay, they look really good. Is there any problems with your teeth at all?
No.
Okay, just open again so I can just see all of your teeth. Looks like you have maybe had one filling or cavity.
Mm-hmm.
Okay, have you had any other dental work done?
No, I had braces when I was a kid.
Okay. Now make a smiley face and make a frowny face and puff out your cheeks. Okay, shrug your shoulders. All right, that all looks very good. Okay, now I'm going to just check your neck. You can just hold that for a sec, okay?
Okay.
So I'm just going to feel your trachea is midline. Okay, now take a sip of that. I'm going to feel for your thyroid. See if there's any masses or nodules. It's palpable. Is that bothering you at all?
No.
Feeling for any lymph nodes. It looks good. Alright. Just have you do full range of motion with your neck. So just go all the way back. Okay, it looks like you don't have any problems. Want to just go the other side, the other way and do that? Okay. Alright, and now just try and turn all the way to the right. Okay, now try and turn all the way to the left. Alright, great. All right, so if you want, just lay back. We're gonna check your chest. Listen to your chest. Just gonna feel, see if there's any lymph nodes. All right, just maybe, I'm sorry. Make sure that you can see the camera here. All right, I'm looking to see if there's any JVD in your chest or your neck. I don't see any. Okay. Go ahead and have you sit back up. I'm going to listen and feel your back. Okay.
Okay.
First, I'm just going to feel, see if there's any anything abnormal, any tenderness.
Nope.
Okay. Just tell me again if you feel any tenderness. No. Okay. All right. Percussing your back, making sure that there's resonance on the top and dullness on the bottom. Sounds okay? Any of that bothering you at all?
No.
Okay. Now I'm going to listen to your breath sounds, okay?
Okay.
Take a deep breath in and out. Again. Okay, great. I'm going to count the intercostal spaces. Just kind of bend down a little bit. Okay. All right. Looks good. Have you lay back down now. I just get my light. All right. Just have you see if we can just take down your shirt. We'll have to have you take off the arms too, okay? Oh, and you can just hold it right at your waist. Put my lights in here. Make sure I can see you on the camera. First, just gonna feel your breast. Make sure that there's no lumps. Men don't usually do breast exams, but we do like to check, make sure that none of the lymph nodes or there's no lumps, just to rule out cancer.
Okay.
Okay, I'm gonna check for your apical pulse. Okay, feel it with your carotid pulse at the same time. Okay, and listen. Carotid. Now I'm gonna listen to your apical pulse. Okay. Now I'm going to listen to all of your heart sounds, okay?
Okay.
Listen to your aortic, pulmonic, Erb's point, tricuspid, mitral. I'm listening to see that the heart rate is regular and the rhythm is regular, which it is. Now I'm going to listen with my bell. Make sure there's no murmurs, no rubs, no gallops. I hear just S1 and S2, so that's good. The love is louder than the dub. Okay, great. Now I'm going to listen to your belly. I'm listening to hear if there's vowel sounds in every quarter. There's no other sounds besides your vowel sounds. There's not. Sounds good. I'm going to percuss. Anything bothering you?
No.
Okay. Now I'm gonna feel for lymph nodes. There's no striae. There's no pulsations. Feeling for if there's any tenderness in your liver. Anything bothering you at all? Okay. And check your temporal pulses, okay?
Okay.
Okay. Okay, very good. All right, I can have you sit back up.
Okay.
Put that back on. All right, great. So now I'm going to get my reflex hammer, and we're going to check all of your reflexes, okay? Let's make sure that. See. All right. So just kind of relax for a sec.
All right.
Very good. All right. So now I'm gonna. Check over here. Okay, great. I don't know if we'll be able to see down there. Let's just see. All right. Looks like +2. And +2. Very good. Now I'm going to check just a couple of your pulses that I hadn't checked before. Just have to get one more with your arm out a bit.
Okay.
Okay. Brachial's good. Your radial is good. Check your popliteal. Just see that a little bit better. Popliteal. And your pedal pulse. Actually, let's, maybe if you go like that, we can check your popliteal on the camera. And your pedal. All right, great. Now I'm just going to check your arms and your legs, just checking the size of your muscles. And then if you want to just push them, pull them out, I'm just checking for symmetry. They look symmetrical. Your legs. Any tenderness at all?
No.
There's no edema. You can fan your toes out. The muscles feel good. They look symmetrical. Okay. That looks good. Now, for the next couple sets of tests, we're going to have you stand. So if you want to just stand over here.
Okay.
And then maybe just back up a little bit. Let's see. Make sure that the camera can see you.
Okay.
Okay, so we want to have you bend down and try and touch your toes. Don't go too fast. Don't go too far.
Okay.
Make sure. Okay. It looks like the curvature of your spine is good. You can get back up. Good. Very good. Looks like You have full range of motion, no problems with your back or any issues?
No.
Okay. And so now we're gonna have you go like this and tap your thighs. Just do one. Okay. Great. All right. And then we'll have you walk this way. Walk on your toes, on your tippy toes.
Okay.
Okay. Now walk back the other way and walk on your heels.
Okay.
Okay. And now we are going to have you walk back this way regularly. Okay. And then walk the other way back regularly. Okay, and now, let's see. I don't know if you have enough room. Maybe, could you stand to the side there?
Okay.
Okay, and then I want you to, could you put your arms out all the way? Okay, so I want you to go like this with one to your nose, and then go, take it off, and then do it to the other side.
Okay.
And then, if you could just close your eyes and do it.
Okay.
Okay, very good. That's good. And then now just keep your hands down by your side,
All right.
and, close your eyes.
Okay.
And we're just gonna make sure that you're not swaying, standing still, that your balance is good. Okay, it looks good. All right, that's great. And now you can open your eyes and then turn towards me again. And then just, if you want, just take one foot and run it up one shin. Actually, can you do it without holding on?
No.
Try that. If you feel like you're gonna fall, don't. But
There we go.
okay, nope. Looks like you got good balance. Okay, very good.
Okay.
So we are going to defer your genital exam today. You said in the history portion that you weren't having any problems. If we were to do a genital exam, though, we would check the distribution and the amount of your pubic hair. We would check for any penile lesions or discharge. We would ask if are you circumcised?
No.
Okay, so we would just document that. We would feel the testes for any masses or tenderness. And you said that there was no problems there at all, right?
No problem.
Okay, and we're also going to defer your rectal exam today. If we were going to do it, we would do a test for occult blood in your stool. We would check for hemorrhoids, lesions, fissures, fistulas. We'd also just check your prostate. For its size and for any masses or tenderness. Have you had your prostate exam before?
Yes.
Okay. All right. So I will let you know a little bit more about my findings after when we go back into the other room. Do you have any questions or concerns that you want to discuss or anything else that you want to check?
No, ma'am.
All right. All right, great. Thank you. You can go ahead and get dressed.
Oh, thank you.